I think everybody should know that their mental health requires as much attention as their physical health. That it's not something that just happens. It's something that you really have to work at. I think there are two periods in my life when I think about why mental health was important. Certainly as a young adult, when I actually worked in the field of mental health, if I was going to achieve any success in my profession, it was by improving the mental health and life situation of my patients. As governor, I have other concerns. I need to have a thriving economy if I'm going to be able to fund the programs that need to be funded, provide the services that Kansans have come to expect, like our schools, for instance. Then I really need a healthy, productive workforce. And we know that people who have access to mental health services and who access those services are going to be much more productive in their everyday work life. So, I see it in some ways now. It's important for the economic foundation of my state that we have people who can go to work every day and perform the jobs that need to be done. Well, as I said before, I think, working on your own mental health is something you need to pay as much attention to as your physical health. So just as I try to exercise regularly to keep my body healthy, I also do the one thing that's important to my mental health, and that is try to find time for myself. When I was in graduate school, I actually did a thesis on, we were supposed to pick the thing we like to do most in our free time. And so I thought about it, and my thesis was on solitude. And that is where and how I recharge the best, is by being alone and with my thoughts, kinds of things that I like to do, and having time for that. So I think that's what I do. I have a very public job. I spend a lot of time with people, and I'm glad to do that. But I've had to force my staff, whether it was my campaign staff or my governor's office staff, to recognize that I need that for my mental health. I need that time alone. Well, accomplishments probably would go back again to when I was actually working in the field. I worked almost exclusively in pediatrics, and to be able to see real change in kids and their ability to cope with everyday life and to succeed where they were not before, I think those were my proudest accomplishments. As governor, I think my investments and focus on early childhood programs is probably the thing that I've done best. Like I said, I worked in a psychiatric center for kids a long time ago. Also worked in a prison, a minimum security prison for boys. And in both of those settings, I realized that it was too late to really make a difference. And so it was at that time in my career that I became very interested in early intervention to prevent some of those issues. So I think as governor, I'm very proud of what we have done in the world of early childhood, both education and care. As I said when I was running for office the first time, I wanted that to be my legacy, is that Kansas has the most robust, most comprehensive early childhood system in the country. Well, I'm working on a ton of things right now. They all focus on ensuring that there are no gaps in the continuum of care. I just talked about early childhood and all the work that we're doing with prevention, but then, and we're doing everything in between. We now have partnerships with our community mental health centers and our schools, so that we have counselors, therapists available 24/7, 365, rather than using just school personnel available only during school hours. We've made a huge difference all across the state by forming those partnerships and expanding access to mental health services, particularly for our kids. And then, we are in the throes right now of the design and build of a new inpatient state psychiatric center down in Wichita, Kansas. Years ago, there was all that push to move people into the community, and we overdid it. We overcorrected by shutting down so many inpatient services, creating a huge problem for our hospitals, where these folks who really need mental health services are showing up in emergency rooms. Same thing with our jails. So, we're now adding a third state psychiatric facility to address some of those needs.
Now it's your turn. Why is mental health important to you? Post on social media with the hashtag #Take5 for Mental Health.